Hello, everyone. You're listening to the Integral Dose podcast. My name is Vale.
Hi, my name is Sarah.
Hi everyone, my name is Sarah.
Another day, another dose. This is the podcast that covers all things related to or integral to radiation therapy.
In today's episode, we are exploring some of the more common misconceptions about radiation therapy.
Yes, I do think it's quite important to address certain misunderstandings for several reasons. For patients, having an accurate understanding of their treatment helps them to know what to expect, focus on the real risks, and let go of unnecessary worries.
Exactly. For caregivers and loved ones, having a clearer picture of the radiation therapy process allows them to better support patients and know which side effects or issues really require attention.
Yes, and for the general public, learning about modern radiation therapy helps dispel outdated fears and promote a more accurate view of the field. It's not an inherently dangerous profession, and safety is actually our top priority in every aspect of our care.
So before we start our episode proper, let us go back to the time before we started our profession as radiation therapists. Do any of you remember any preconception of what RT is like, or what were some of the misconceptions that you thought?
Not really, but we can explore more, and maybe you can share with us a bit more, Sarah.
Actually, we compiled a list of commonly asked questions pertaining to radiation therapy.
Let's say we can revisit the time that before we joined RT, what are some of the things that you thought were true, but then now that you're in RT, you know that they are not true. So I thought it was an interesting exercise. Yeah.
Actually, right, before joining RT, I have really no prior knowledge about what radiation
Actually,
therapy
same.
is. So,
Yeah.
with no knowledge, I have no misconceptions.
All right. Okay. Yeah. Okay. So you really learned more about radiation therapy as you went along through the education
that's
program.
right.
Okay.
That's right.
Very cool. Yeah, similar experience. I don't think I knew that much about RT, radiation therapy, before I joined. One thing that I thought was that RT could be used alone by itself as a treatment on its own. But since joining RT, I learned that that's not true. And we oftentimes use a lot of other treatment techniques like chemotherapy and surgery as well. So oftentimes RT is used alongside these other treatment modalities. Yeah. So it's not just a one thing.
I see, yeah.
On my end, I initially thought that each RT works independently. So
Okay.
it's more of like a one RT operating one machine kind of concept. Much like our other allied healthcare professionals like physiotherapists, where they have a list of patients under their care specifically. After joining the profession, in actual fact, RTs work minimally in a pair or at least in a team of 3 or more to operate the machine and to ensure that our patients are treated safely, and treatment is accurate. So it's quite a vast difference from what I imagined prior to joining this profession.
Yeah. It can't just be one person administering this therapeutic dose of radiation. That sounds a bit scary, to be honest.
Right.
Okay.
Now that you understand, it does sound very intimidating. Yeah.
It does. Yeah. So as RTs now, as radiation therapists now, it would seem a bit more natural to us that we understand these things better.
Yeah.
Back then, we didn't really understand things well, and we went through the education pathway to make sure that we now understand it. There were misconceptions from us. And as a patient who might just be starting their RT journey, there might be misconceptions for the patients as well.
Yep.
Yeah.
Okay.
So one of the common questions that we get a lot is whether the radiation burns. Is it extremely painful? What will I feel, as the patient is undergoing radiation therapy? It does seem like a very intimidating process to go through. In fact, the actual treatment is painless. Patients do not feel heat or pain or any burning sensation during the radiation process.
Yep.
Patients lie on a table while the machine delivers the radiation around them and the machine does not touch their body. Some patients may experience side effects later, like skin irritation or fatigue. However, the severity of this varies from person to person, and they are closely managed and monitored by the healthcare team, who will be ready to provide any remedies or management of side effects like application of skin gels, moisturizers, and creams, or any other way that they can help you with pain management, like certain pharmaceuticals, certain medications that can help.
Yes, you're right, Will. So apart from that, actually, some patients also will tend to ask questions like, will I lose hair? So some RT side effects are actually localized. So hair loss will only happen if the radiation passes through that particular region of their hair follicles. So I wouldn't say that you won't lose hair, but for a certain site, they have been passing through the head area, so they will lose some of the hair. And basically for patients who are undergoing the pelvic regions, don't usually see any hair loss.
Yeah. This is in fact a very common question that we get a lot as well.
Oh yes, to add on, it's not losing hair like a full hair loss, but it just shows up in like patches of
skin without hair.
Where the radiation beam targeted.
So a common theme along like all these questions, right? A common thing that will keep coming up is the fact that radiation side effects are very localized. So someone who is undergoing radiation therapy for the brain, as compared to someone who is undergoing RT for the pelvic region, would experience very different side effects. They would have a totally different journey and experience ahead of them, you know?
Yep. How about like, sometimes patients regard us as doctors.
Oh.
Yeah. Do you have that common misconception about artists being doctors?
I suppose, yes, right? I suppose like sometimes the elder generation doesn't really understand like the role that allied health professions fit into the healthcare system. So we are either doctors or we are nurses.
Correct. So either these two. So particularly the older generations lah. So we are not medical doctors, but we are highly trained healthcare professionals who specializes in delivering radiation treatments safely and accurately. And we work very, very closely with our team of radiation oncologists, as well as the medical physicists and dosimetrists, so that we ensure every patient will receive the right dose at the right site, and also we play a key role in patient care, like checking on their side effects mostly, and offering them assurance as well as management on their daily quality of life.
Yeah.
So for patients, RTs are actually some of the familiar faces that they will see most often during their treatment.
Yeah.
And we actually know our patients better. And sometimes we will bring it up to the radiation oncologist if something is amiss, or a particular patient requires prescriptions. So we will actually seek the radiation oncologist or the doctor's help to prescribe some medications.
Yeah, that's right. So the people that we work with closely, the radiation oncologist, is a doctor by training, by profession. And basically, if everything is going smoothly with their treatment, patients don't have to see the radiation oncologist every day. So it's usually like a weekly review by the oncologist, and then patients will see us, the radiation therapists, every day. That's how we get to know our patients kind of a bit better than the doctors themselves.
Yeah. I guess you can say that. We are mostly there as a guardian.
Guardian of the beam again. All right.
Okay, we are just we can be their second caregiver or like
pertaining to any of the issues that they need requiring the radiation treatment. Yeah. So
that's right.
there's more categories of staff in the hospital setting than just doctors and nurses. There's an entire class of allied health professionals that are very specialized in their own skill set, and we belong to one of these.
Yes, that's right. So Sarah, do you have any inputs you want to share
Regarding this topic, is it?
Yes, I mean you seem so quiet.
More like, are you ready?
I think it's okay. I think there's enough input for this particular part. Patients commonly ask whether they will be radioactive after treatment, and as such, would they have to be isolated? This is only true in very specific cases. So for radiotherapy, most people undergoing this treatment do receive something that we call external beam radiation therapy, which therefore does not cause them to be radioactive. So these people are able to still be around others, including children and pregnant women, as well as elderly. However, for other internal treatments such as brachytherapy, temporary precautions may be needed, and the healthcare professional taking care of you will clearly explain those if they apply. So, for example, there are some diagnostic procedures that involve injecting a radioactive tracer into the bloodstream, and therefore these patients who have undergone this procedure are required to avoid coming into contact with vulnerable people like pregnant women or the elderly for about the next 6 hours or so. So it's really important to listen carefully to the instructions provided by your healthcare professional.
Yeah, actually, this is actually a common question we receive from patients themselves, whether they are radioactive. So on our part, mostly, they are not radioactive. So patients don't have to be isolated.
Yeah. So I like to think about actually our profession is very safe. The fact that when we turn off the radiation, there is no more radiation. It doesn't really linger around. It doesn't dwell in the air. It doesn't make other things radioactive. Yeah, so that's basically about it. So one thing that I'm really thankful for about being in this profession is that RT is actually a very safe job. It's very safe for staff and the general public alike. So we do have a lot of precautions, and safety is a really high priority. A lot of our treatment rooms, treatment areas, the walls are made of either lead or concrete shielding to ensure that the radiation doesn't leak out. There is a maze design, and we take into account the door opening times as well as a safety mechanism to ensure that the radiation, no one enters the radiation bunker, all the radiation lights, sounds, and warning signs. Yeah. Also, as a staff, we also carry around a device known as a thermoluminescent dosimeter. It's also known as a TLD, and it's a device that helps us to monitor our radiation doses. Yeah, so we always take this very seriously, and we always have to have our TLD badges on us whenever we are walking around the entire department. And yes, you may have seen some RTs who are pregnant and they're still working, and that should be a testament to how safe this profession is.
Yes, Phil, that's right. As an RT, there are a lot of measures taken to protect us, and we are absolutely grateful that those protections are implemented, and we do our job safely lah. But there is also another thing that my patients or generally the public would like to know: does radiation therapy disrupt their everyday work life or routine? Will RT make them too weak to even walk or even live normally? So this misconception that I would like to address: fatigue is a common side effect from radiation therapy itself. Yes, they will tend to feel very tired from radiation therapy, but every patient experiences it, radiation fatigueness. However, they still continue with their daily routines, such as working, such as doing light exercises, So they still continue doing all those things. And patients are actually encouraged to be active while they are undergoing radiation therapy. Not like those gym active, but maybe just like walking, take a light stroll around the park. That's perfectly fine.
So apart from the radiation itself, there is a direct cause to the tiredness or fatigue. It can actually be quite physically strenuous and taxing to travel to the hospital every day. So that may contribute as part of the fatigue as well. So while we do encourage our patients to continue being active, continue taking strolls in the park, like maintain a moderate amount of activity and exercise, this is just so that patients can maintain some semblance of a normal life and not become completely sedentary.
That's right.
However, you also shouldn't do something very strenuous like mountain climbing or go run a marathon, like resting should also be part of your priority as a patient while you're undergoing radiation therapy.
That's right.
We also hear from a lot of patients, especially in the Singapore or like the local context or even from other Asian cultures, where the concept of being heaty is pretty common. So does RT make patients heaty? Do they have to drink a lot of water during the course of treatment? Now, heaty is a term in the Chinese context where we often use it to describe things like feeling warm, dry, tired, or even having mouth ulcers and sore throats. Although there is no scientific evidence that radiation actually increases your body temperature, some patients do in fact experience side effects that feel like heatiness, such as dry skin or sore throat. Therefore, it's not uncommon for patients to have this misconception. Unless you are given specific instructions, our general advice as radiation therapists is to drink just sufficient water to keep yourself hydrated, which is about 2 liters per day or about 8 glasses.
So another point, while browsing around on forums in the internet, some people have been asking, or somehow they just have this impression that radiation therapy is only used as a last resort. Like it's a last-ditch effort, like I can't, maybe the healthcare team is unable to like perform surgery to remove the whatever tumor it is, and to the extent that like drugs and chemotherapy are already not helping. So it feels like blasting it with radiation might be the last-ditch effort to save the patient. So I would like to point out that this is not true. RT is actually part of a carefully planned treatment approach. And RT can have a few intentions as well. It can be completely curative, to cure, or it can be to shrink the tumor before surgery, or to ease symptoms. And these don't necessarily apply to only the late-stage cancers. As mentioned previously, oftentimes RT is used in conjunction with other treatment techniques to amplify and synergize with their therapeutic effects.
Yep.
Yeah.
That's right. How about then, like, will radiation cause cancer?
Right. This is a thing that some people might wonder as well.
Yeah, it's true.
So actually, radiation therapy, like what Vil say, is a carefully planned treatment approach. And it is designed to actually maximize the benefits and minimize the risk. So in modern radiation therapy, it is highly targeted or localized to treat the cancer alone while protecting healthy tissues. While there is a small risk of long-term side effects, which includes secondary cancer developing as a result of radiation exposure, all these are considered very carefully. Usually the benefits of the treatment often far outweigh the risks.
Yes, exactly. I think this is a good time to think about drug dosage and medications as well. Every medication that we take inherently has some form of risk. So the point is to really maximize this thing called therapeutic ratio and make sure that we take enough of the medication to cure whatever ailment that we have, and at the same time not develop so many side effects that it makes us unbearable. So this concept of maximizing benefits and minimizing risks or minimizing complications, this is everywhere in medicine, and radiation is the same.
Yeah.
That's right.
Right. So we have covered everything.
Okay, so these are all the common misconceptions that we will be addressing today. There are definitely more misconceptions, but we will probably save it for another episode. Yeah.
Yes.
Yeah. I feel like there's so much to talk about for this.
There is still more to talk about the misconception, but mostly like what Sarah said, these are just the most common ones lah.
Right. Yeah. Anyway, it's been fun addressing
Yeah.
of the questions. And remember that we are all coming from a place of knowledge sharing.
Yeah.
There's no shame in not knowing certain things. And after all these are not very commonly available information that you can find on the internet. And all in all, we are glad to contribute towards the availability of such information online.
That's right.
Do you have any other questions? We have a comment section on our website. Feel free to keep in touch. Leave feedback, more episode suggestions, and tell us what you would like to hear from us.
Yeah. So please rate, review, and subscribe. Follow the podcast on iTunes, Spotify, or wherever you get your podcasts.
Thank you once again for listening to Integral Dose. This has been your dose of content for all things related to integral to radiation therapy.
See you in the next
episode.